I'm doing an interesting case today, and I bet you have not heard of it. So I'm doing a breast reduction on a young girl who has juvenile gigantomastia. So I do breast reductions all day, every day, one of the most common procedures in the United States that plastic surgeons do. But true gigantomastia is relatively rare, and this is where someone develops exactly what it sounds like, absolutely gigantic breasts. And in this young woman, it happened at puberty. So usually the diagnosis is that you have to have at least 5 pounds of breast tissue, and your breasts have to comprise over 3% of your body weight. And in many of the patients that I see like this, it's much more than that. So with this type of breast reduction, we actually don't recommend that you wait until you're over 18 or after having kids, because these breasts are so large, they cause not only significant psychological distress, but they cause major physical symptoms, horrible back and neck pain that can become permanent, and patients actually can get serious injury from having breasts this large. One of the most common mistakes I see is that well-meaning people in the medical community will see a young girl with juvenile gigantomastia and say, hey, you need to wait till after you're 18, and then you're forcing this kid to live with breasts that are absolutely enormous for years and years, and that's not a good plan. So there's of course a risk that this will regrow afterwards and that your breasts will become large again, but it's actually not common in my experience. And so I think that risk is worth it to save that young woman from the psychological and physical torment of having these breasts. I would show you a photo, but I'm not trying to get kicked off of TikTok today, so you can go ahead and Google it online. I've also seen gigantomastia happen in pregnancy. So believe it or not, this can actually be a life-threatening complication of pregnancy. I've had 2 patients that developed gigantomastia in their 2nd trimester, and they developed ulcers and significant bleeding from these ulcers. And both of them required an urgent mastectomy during the 2nd trimester of their pregnancy, which is not something we ever want to do as plastic surgeons. So my whole team is really excited for this patient today. It's always fun to help these young ladies feel better about themselves and be more functional in their bodies, but I just thought I would share with you because it's not particularly common. I only see maybe 1 or 2 of these patients a year.